I became an audiologist because I wanted to help people hear better. So I initially took American Sign Language as my foreign language in high school. And I actually got pretty immersed in the deaf culture back in my hometown in Spokane, Washington. And then I actually was talking to one of my professors who had an audiologist, and it sounded like a really cool field. So that's what I decided to do. Oh, my favorite part about the profession is actually getting to know my patients. So I love the process of meeting someone for the first time, hearing their initial struggles and what they're going through, and getting to know their lifestyle and their family as we work throughout the journey and seeing where things have changed in their lives due to hearing better. So the reason I like Hearing HealthCare Centers and the way we do things is it feels more small town, where we are actually trying to help people throughout the course of their whole journey and getting to know them. It feels a lot less corporate. And so we're following those best practices as best we possibly can. But because it has more of that small town feel, I have some of that flexibility to really do what's best for my patient. The patient interactions that really warms my heart. Actually, we do something in our office called ROSU, where we look at how a patient's performing before and after hearing aids. And that can be really impactful, especially when their family members join them in appointments. I have seen a lot of patients go from hearing, less than half or maybe even nothing of what their family members were saying. And then we put hearing aids on them in a couple of minutes. Their brain is already starting to adapt and they are starting to hear better, and they can now hear their families. Normally that brings tears. What I want patients to know before they come to Hearing HealthCare Centers is I want them to know that we're going to take good care of you and that we really are trying to follow best practices to get you hearing better rather than just slapping a product on your ear and calling it a day. We want to walk you through this whole process, educate you, and walk with you the whole time.